Hello, everyone, and happy Women's History Month. Thank you for joining us. My name is Tim Russell, Vice President, Community Engagement and Diversity, Equity, and Inclusion for WTTW and WFMT. And welcome to today's Chicago Tonight Latino Voices, a WTTW News Community Conversation. WTTW's purpose is to enrich lives, engage communities, and inspire exploration. With WTTW News Community Conversations, we hope to surface and spotlight ideas and stories behind the headlines by creating a forum for residents, community-based organizations, and community leaders, residents, to have authentic conversations. Tonight, I am excited to welcome our special guest host, Araceli Gómez-Aldana. Araceli is a reporter and host at WBEZ in Chicago. You can listen to Araceli on 91.5 WBEZ during NPR Weekend Edition on Saturdays from 7 a.m. to 10 a.m. and on Sundays from 8 a.m. to 11 a.m. Support for Chicago Tonight Latino Voices is provided by Allstate and CIBC. Additional support is provided by the Abe and Ida Cooper Foundation, Lloyd A. Fry Foundation, and Judy and John McCarter. Now, I would like to welcome Araceli Gómez-Aldana to the computer. Thank you.
Thank you, Tim. And hello, everyone. Buenas noches y bienvenidos to Chicago Tonight Latino Voices, a WTTW community conversation. Thank you for spending your evening with us. I'm Araceli Gómez-Aldana. I'm a host and reporter at WBEZ, and I'll be your host for the evening. Tonight, we're shining a light on Latinas for Women's History Month, their history in Chicago and the US, the adversity Latinas face in this country, and the role they hold in their communities. You're all in listen mode right now, but that doesn't mean you can't be part of the conversation. We want to hear from you and we want you to participate. So please chime in on the chat function with your questions and comments, and I'll be sure to share them with our guests tonight. And speaking of our guests, I would like to introduce our panel and thank them for taking time out of their very busy schedule to talk with us and spend a little bit of their time with us today. First, I'll introduce Adela Cepeda. She's an independent corporate director. Cristina De La Rosa, Senior Director of Programs at the Erie House. And Maria Pesqueira, I want to get this right, Maria Pesqueira, President of Healthy Communities Foundation. Thank you for joining us, everyone. Okay, so reminder, you can ask questions in the comments and we'll get started. I think it'll be beneficial to get to know a little bit about our guests today. So I'm always wondering how people grew up and a little bit about themselves. So when we're talking about who you looked up to growing up, maybe leaders, mentors who've inspired you. Adela, how about we start with you?
Oh, thanks so much. And thank you for hosting us tonight. I looked up to my mother because she was and still is a heroine to me, even though she's no longer here. But she really decided that we would come to the US. And she left her business where she was the only woman selling furniture equipment. She was the only married woman. She was the only woman with children. They kept breaking the rules on the limits to women. She was extremely smart. And when she came, within 2 or 3 years, she saved enough. We came as a family unit with my father, but she saved enough to purchase a home. And so that kind of set a foundation of financial stability for our family, in addition to all the hard work that both she and my father, but in terms of a woman that broke records, my mom.
Yeah, strong woman. Cristina, what about you?
Again, thank you for having us here today. Growing up, I would say that it was also my mother. I feel that I was fortunate that I had a hardworking mom who went above and beyond to make sure that the family had what we needed, but also a good group of friends. I think that I went to Chicago Public School, born and raised in Chicago. and really looked up to the folks ahead of me. And they went on to college, and I said, I have to go on to college as well, and really looked on. And then some of those friends I hold really near and dear. And right now, I would say I've been fortunate in the last couple of years to have worked alongside some great managers and women that really inspire me. And I think it's important that we really think about who we surround ourselves with, and are they folks that will give us love, but will also let you know the truth and give you some hard feedback when it's needed. I feel like recently in my career, that has been very important to me and part of my professional growth.
Yeah, definitely. And Maria, last but not least.
Great, thank you, Araceli, again for moderating this conversation. Well, as we asked this question, and I thought about this earlier today, I couldn't help but think of the many sheroes, right, that I've had the pleasure of getting to work with personally, as well as to be inspired by, whether it was Maria Mangual, who founded Mujeres Latinas en Acción back in the 70s when she was a college student, right, or people like Dolores Huerta, who certainly, was the Si Se Puede. She is the Si Se Puede, right? But then I also think about women like my mother, who came to this country for a better life, for her and her entire family. She was one of the first women to work at the company that she worked at. She is a math whiz. And thanks to her math wizardness, truly, thanks to her, she helped inspect the shuttle that put a man and a group of people on the moon and back. And so, again, she is a quiet shero. Maybe not so quiet to me growing up, but I have had the pleasure of having quite a number of very strong women in my life.
Oh my gosh, it's like we need a whole conversation just about that. It intrigues me. What, traveling to the moon and the math and everything. Thank you for sharing that. I know sometimes there's so many people that you could choose from, right, that inspire us every day. Adela, I'm looking, I introduced you and you're a leader in the finance world. And we know that that's an industry to be dominated by men, historically white men. So I'm curious, what has your experience been in that field in your career, and maybe have there been any challenges that you've had to overcome?
All the time, because as you say, in finance, there are very few women of any color or ethnicity, really. In high finance, in corporate finance, it's really, or certainly when I joined that field in 1980, so we're talking 40 years, they were just beginning to bring women to Wall Street. So we didn't have the connections, the network to bring business, which is ultimately how in these consulting businesses you are most successful. So that was a setback, a hindrance. But I did learn, so much. And I do think that the corporate sector has tremendous value. I learned everything working over a decade with a Wall Street firm, and then started my own business. But I wouldn't have been successful without that grounding. I have to say, the discrimination was subtle. I would say that, in a lot of cases, I got preferred seating, I got preferred inclusion. Sometimes the guys thought it would be good to have a woman. So I wasn't excluded, and I made sure to bring other women along as soon as I could. And as soon as I was managing more of the projects, to have other professional women. Mm-hmm. And of course, in my own business, it's been a lot of women. So
were you able to find kind of a group, a support system within, especially you said in the 80s, were there other women that you could gather with?
It was very difficult. And I was so young. I started right out of school. And when I tried to join professional organizations in Chicago, really, for the most part, I was rejected. So I developed more of that network through my husband's relationships and connections. And and eventually was able to join other leadership organizations for women, but much further along. So really it was go as you can and figure it out yourself, and with women peers than with women mentors, because they just weren't there.
Yeah, can imagine. And Maria, president of Healthy Communities Foundation, what challenges have you faced in your career as a leader?
It certainly, I didn't start out as a president of the Healthy Communities Foundation, and it has been a journey that has led me to this current role. And that journey has been thanks to a great deal of support from early on in my work in nonprofit management, in which by complete accident I went into, where I've had amazing mentors in the sector, including men. Carlos Tortolero at the National Museum of Mexican Art, one of my first mentors, and sort of leading the way in nonprofit management for the Latinx community. And then I had the fortune of being in a role that was about strengthening women, that was about having women in the center at Mujeres Latinas en Acción, an organization that empowers Latinas and their families, working in the human service sector, having the opportunity to sit on a Congressional Women's Commission to look at the possibility of a women's history museum. So the journey around women, for me, as I've been fortunate from that perspective. I am one of a few Latinas across the country leading a private foundation, and that needs to change. We need to have more women in leading private foundations, and certainly more Latinas representative across the country.
Mm-hmm. And so kind of what I asked Adela, I'm glad you were able to find, especially with Mujeres en Acción, maybe women around, right? But did you feel like you had a support system and peers to gather and just kind of, desahogarte and talk to you about these struggles that you were facing at work?
So fortunately, I've always had a network, and I found myself to have a close group of women who I can tap the brains on, what asking them for solid advice, feedback, as well as constructive criticism. And I would say that I've had that throughout my career. I've been very fortunate, and currently here in the Chicago area, believe it or not, we happen to have one of the most women of color leading foundations than any other city across the country. And so I'm fortunate to have a group of comadres, if you will, sisters in the work.
Yeah, well, I didn't know that. That's something to be proud of. And Cristina, I'm coming to you. You're the Senior Director for Programs at the Erie House, a leader in the community. What about you? What has your experience been?
Mm-hmm. Yes, I also have been, my entire professional career has been in nonprofit. And so I have about 16 years of being in a nonprofit. But really, I feel like my management and leadership journey started and was developed at Erie Neighborhood House. We're a nonprofit as well in the city, almost 151 years old. And we provide comprehensive social services. We have early childhood education, and then we work with children, youth, adults. And we're talking about women in the workplace. And while there are a lot of women who are in the nonprofit sector and are providing a lot of these direct services and caring for our communities, we're underpaid. We're working on thinking through how we could ensure that the folks that are providing the service, right, they're the ones out there providing the support, but how do we look at ourselves and also make sure that our staff also have the support that they need and are valued for the work that they're providing. And so I've also been fortunate, I think, in the last couple of years, I mentioned earlier, to really have found a group of peers that are strong women, they're strong leaders, that have really been able to provide me with some great mentorship. I will say I did lack that in the beginning, but I've been fortunate that I have been able to find the support that I need, especially as I've developed as a leader. The challenges are bigger. The fires are bigger, and you really need a lot of brain power to think through a lot of these challenges and think how we can come out better for the future.
Yeah, that weight on the shoulder gets a little bit heavier.
Yes,
as you head up the ladder, right? And I think you all gave a great description and really were positive about your guys' experiences. And that says a lot, even looking good with the bad. But there have been challenges, especially we know Black and Brown communities have been disproportionately impacted by the coronavirus pandemic. We're living in this global pandemic at the moment, and we've seen both health and economic perspectives be affected in our communities. I'm wondering, Maria, what about the impact from the virus have you seen among women, particularly Latina women? How has this been impacted to them?
Well, certainly the pandemic has shed light on and has deepened the inequities that Latinas have faced for decades in this country. And we certainly, as we think about COVID, can't look at it only from the issues of Latina and a female perspective. When you think of Latinas, we must look at it from a family perspective. What do I mean by that? If you look at the infection rate, Latinos, the Latinx community has had the highest, we have had the highest infection rates in all the age groups up to 60. So as you think about that, the fact that Latinos have the highest number of COVID-19 positive cases and the highest number of long haulers. So what does that mean in terms of our plans for recovery? The fact that the pandemic has the implications are not just for Latinas, but their children and families, and think about it from the perspective of the undocumented, having to choose between eating or paying their bills. As we think about how the stimulus packages went out under the previous administration. The fact that they're being evicted from their homes despite the moratoriums that are in place, and worse, some being harassed by their landlords, right? The fact that having children taking care of smaller children, we're trying to do remote learning, right? So as we think of all of these various pieces that are heavily impacting us, our community, and thinking about it from the social determinants of health. So we know that not having access or wanting to access the healthcare system due to fear is one aspect of it, due to public charge. But then let's take into consideration even the overall access as a whole. I mentioned that the Latinas, the Latino community has had the highest infection rates. Something else that should be taken into consideration is the fact that as far as pregnancies go, Latinas have had the highest level of pregnancies during the pandemic, that while having COVID. The fact that Latinas have had the most deliveries while having COVID, sometimes discovering that they have COVID in the delivery room. Again, what does that mean on a long-term basis? And as we think about it from an economic lens, that, I'm sure Adela could go a little bit deeper into this, but certainly we now know that this particular economic crisis has been dubbed a she-cession, and because how it is impacting women even more so than men. The jobs that have been lost in industries that many women work in. the fact that we were just coming out. Latinas were just coming out of the 2008 recession, and here we are back in this economic perspective.
Yeah.
So
definitely. And before I head to Cristina with the same question about what you're seeing, I want to remind our guests, our audience, that you can leave us questions or comments, or if you have a personal thing you would like to share, feel free to message, and we'll get to those as well. So, I mean, Cristina, we just heard Maria kind of, give a roundup. What are you seeing with regards to the impact that the coronavirus pandemic has had on Latinas?
I mean, I would say it's a lot of the same that Maria has already shared. A lot of the work that we're doing is directly with families in Little Village, or with Latino immigrant or Latinx immigrants, and it's a lot of those same things. Deciding, am I going to put food on the table? Finding childcare. A lot of childcare providers were closed for a while, and that really greatly impacted women that had to go to work, that are essential workers. Because a lot of women are essential workers as well. And so they were forced with some grave choices. How can I find childcare and still make it to work? How am I going to be providing for my family? So definitely a lot of what Maria has shared, but also just thinking through access. So we're like, how do we share the information about where to access? How do you access testing? How do you access right now the vaccine? Sharing information with our communities about the benefits of getting vaccinated, or at least if that's something that you would want to do, how do we make sure that where you can get it? So I mean, really, it's that. It definitely have been an economic impact as well. And so for those reasons, a lot of nonprofits, foundations, and other even for-profit industries or sectors have really rallied around providing a lot of this direct support to families that have been impacted by COVID.
Yeah, I mean, we've seen, of course, everybody in the beginning was so focused on health. And I mean, obviously, people didn't know what to do and how to protect their families. But then we started seeing all these other things. Adela, we saw that women were leaving the workforce. I mean, that's something that kind of came out, and we kind of, in retrospect, saw that a lot of women were leaving the workforce. What about the economic, impact that this has caused on Latinas and the Latino community?
Well, the pay gap that Latinas suffer is the biggest impediment to success for Latinos in America, for Latino families. It's impossible for a family to be financially viable with one of the two wage earners earning 53 or 55, whatever it is. It's totally inadequate. And being in those positions that are kind of essential, and so that forced so many Latinas to work, contract the COVID, has just created a horrible situation in our communities, and showed in very vivid color the kind of inadequacy that we suffer because of this financial condition, because families that can earn 100% on the dollar have savings. And these savings enable them to carry on with either work or not, or lack of work, but to pay the rent, to pay for food, to do everything. But when you have a family member, and sometimes the only family wage earning member at 55 cents on the dollar, that is not possible. Mm-hmm. And I think that there are very few silver linings to what happened. There are, almost 600,000 American deaths. There's the illness and the long-term consequences of the illness that is brought on by COVID. But the one thing that there's been a tremendous review of injustice, social injustice for people of color. And I think that shedding light on this unfairness on why we are targeted for lower pay is important. It's important for us too, you know, because we have to be more cognizant and really fight for fair wages for ourselves in order to advance our families. It's our job to do it. Whatever the social difficulties of managing that, no. I mean, we work too hard. And so we have to be advocating for more more economic equality for our families and our women.
Yeah, and we have seen these first accounts of people that are struggling. You know, the hospitality industry is among some of the hardest hit during the pandemic for reasons. Obviously, the pandemic closed a lot of things, and older Latina women are overrepresented in the hospitality industry. And we have a clip from Latino Voices from a segment earlier this year. A former employee of 20 years, Teresa Hernandez, she talks about her age being a barrier to find another job.
For me to go and apply in another place, and besides that, I'm trying to apply in a factory and they got already their own people, they're not going to hire me because my age.
You know, it's so hard to hear something like that. Cristina, do you want to talk about, you know, the job loss? Maybe you've seen this in the community for what this means for Latinas in Chicago, the long-term impact of something like this.
Absolutely. Yes, I mean, we've seen it across all sectors, you know, and hopefully, you know, like most of the folks that have lost their jobs may have had access to unemployment benefits or some form of support from the government during this time, but a lot of Latinas didn't, right? It could be for a variety of reasons, immigration status, and we also have to think about the policies that were in place at the time as well. If you were a mixed income status family, you weren't eligible for any type of benefit to help during these tough times. And so we definitely have seen a lot of job loss and a lot of places where our families weren't able to secure or seek any type of financial assistance, which at the end of the day is really what our families needed, just cash that they can readily use to whether to put food on the table, to pay their bills, pay their rent, ensure that their children are safe and have a place to sleep. And so it's definitely, I'm curious to see what it's going to look like as folks are coming back to work. And as Maria mentioned earlier, how are we beginning to think about how are we going to support our families moving forward post-COVID? I'm really thinking about the resources, what type of job opportunities are going to be available for them. Are we going to have the capacity to serve our families? Do we have the infrastructure in place? I think those are all things that we absolutely need to start thinking about.
Yeah, and like Adela mentioned, we just, last Wednesday, it was Equal Pay Day, where Latina women earn 55 cents for every dollar that a white man earns. When we think about that, and like Adela mentioned earlier, we were just getting over that a little bit. Maria, do you see anything in the community that kind of hints at the struggles that Latina women are facing? And like Cristina said, what happens next, right? That's a big question that a lot of people are asking.
Well, certainly, absolutely, Latinas face bias in accessing equal job opportunities and getting paid a fair wage. I recall a few years back, there was a study that was done celebrating the accomplishments of Latinas. And as I dug deeper in the data, I realized that information not only showed that, again, highlighting the fact that today that is 55 cents to a dollar, and it was, or sometimes you get 49 cents to the dollar, depending on which data you're looking at. But one of the things that came out of that information was that Latinas were entering college at a higher rate than their male counterparts. And so while we look at the data of Latinas and their wage, again, from Adela's, what I mentioned about just looking at it from a household perspective, right? What does this do when we look at the fact that Latinas are entering the workforce, not getting paid a fair amount, and yet their Latino counterparts are not making it to college or graduating from college at the same rate. So as we look at it from a family perspective, and I have to do so as I think about it from that perspective, it is certainly alarming to the entire Latino community, and certainly something that we know that it was pre-pandemic. We already had low wages. Where will we be as we try to rebuild, as we try to recover?
Yeah, and talking about recovering, of course, we have seen the city of Chicago roll out its vaccination plan. And like, like Maria mentioned, we're trying to see what comes next, right? So we have a clip. So Dr. Mariana Del Rios of UI Health was the first person in Illinois to receive a COVID-19 vaccine. We have a clip from Latino Voices interview with her about the vaccine distribution.
I'm happy to see that we're starting to be more purposeful in how vaccines are being distributed and really trying to pay more attention to our communities that were hardest hit by COVID. But, the realities is that as Dr. Mora just stated, COVID has exacerbated and exposed inequities that have just been building up and gotten worse over time.
Yeah, so in the clip, she's referring to Dr. Mora, who has been a very outspoken doctor and has provided a lot of public service and communication to the Latino community. And Maria, I'll go back to you. What does it mean, when you hear Dr. Del Rios talk about getting the first shot, and how has the vaccination distribution impacted folks from your work, particularly Latinas?
Sure. So as we think about in order for us to get out of this current crisis, we need to get vaccinated. So we need our entire communities, all the communities, but we certainly need, when I mentioned the fact that the infection rates amongst the Latinx community from the youngest up to the mid 60s amongst the highest, we need to make sure that our communities are vaccinated. And so, yes, we've made some progress. But when we think about it from the city and suburban perspective, we still have communities in the city that had high infection rates that are just getting the pop-ups now. We're on the suburban side, we're just beginning some of the mass vaccination to take place. And we know that many of the Latino communities have been pushed out or have grown into the suburbs. The Healthy Communities Foundation, our focus is in Western Cook County. We have a footprint both in the city of Chicago and suburban, and so we can see it from both lenses. But it is important to continue to get the vaccination. I also need to also shout out to these sheroes or these individuals like the Dr. Del Rios, but also the promotoras de salud, many of whom are women, and the health promoters who are the ones encouraging folks to become vaccinated and who were assisting with COVID-19 contact tracing, as well as connecting to resources needed during this pandemic.
Yes, definitely. Cristina, can you talk about that, especially with regards to the community, how crucial, word to word mouth conversations or, people to people conversations have been as we see the rollout of vaccines here in Chicago?
Yeah, I think that's a very important shout out to really, think about who's doing that work. And that's right. It's our promotoras. It's community members that really, care about creating access in their communities and sharing this information and making sure that folks are informed, that they receive the right information as well. And we have seen that. We have the community workers, outreach workers, that have been working throughout this entire time and have come down with COVID because they know that they had to continue, for example, doing census work. They had to continue to make sure that folks had access to resources that a lot of community organizations were providing. Do you know you can come and get food now? A lot of folks, specifically, I can talk about Little Village, a lot of the nonprofits and other stakeholders, we have been meeting weekly to think about how can we create access to the food pantries. How could we make sure that folks are getting vaccinated, coordinating that. There are a lot of efforts that are happening across the city where, you know, they'll allocate a certain amount of slots to an organization and say, your folks better call them, let them know that they can come, help them set up their appointments. I mean, there's also a technology barrier, where you have to go online. I mean, yes, you can call, but trying to get through has also been an issue for some folks. A language barrier often sometimes as well. So there's also that direct assistance that we have to provide to just even help folks navigate whatever technology application they need to complete to get their vaccine. So there's a lot of those community workers out there that are doing a lot of this one-on-one talking to people, maybe even picking them up or just making sure that they have a ride to their appointment, calling them not to forget about their appointment, making sure that they feel safe and secure, so that we can increase the amount of folks that are vaccinated, trying to bring a lot of these infection rates down, making sure too that your family is safe. Let's also think about who's in our household. It's not just mom or caregiver or dad. Oftentimes we have elders in our homes who are vulnerable, and how are we making sure that we can keep everybody in the household safe?
Yeah, I mean, these grassroots efforts have really come to the forefront to make sure that information is being accurately distributed. Adela, what have you seen in your circles with regards to the vaccine? You mentioned, coming from a family with a strong women in it. And I kind of think about my circles and how much we depend on other people to get our correct, accurate information. What has your experience been?
So in my circles, I don't know anyone that didn't want the vaccine. The problem was getting the vaccine to us for all the problems that Cristina enumerated. The language barriers, it's just for us to be on hold for 45 minutes. That's just not something we culturally do. I mean, who does that? You hang up because you're too busy. You have to go to work. You have to take care of kids. Nobody can be on a call 45 minutes. That's just crazy. So there was not, a rollout that made sense for our community. Also, we're younger. So having these age limits that's, 75 and 65, the bulk of our community is a lot younger. So it isn't until now that we can really be out there. But to people that ask whether they should have the vaccine or anyone that ever says to me, well, I think I'll wait. And I say, really? You'll wait? Because there's already been 550,000 deaths. So you know what COVID does. So you're waiting to get it? You're waiting to get this more advanced, faster, more contagious version? I mean, it's just, there's no logic. The only thing we can do for our community, for our family, for everyone, and for ourselves is to get the vaccine. That's the number one priority. Everybody has to get the vaccine. And we have to be saying that in English, in Spanish, in slow motion. And we have to have, I want to give a big shout out to Esperanza Health Centers, because I think they've really mobilized and they set up, areas devoted to the vaccination process, and they're in the community, and they're really prioritizing Latinos getting the vaccine. And that's what we have to see. We have to have it accessible and walk in and do it. And more vaccine.
Like you mentioned, and we have to get through to people all different languages, right? Not just English or Spanish. There's a lot out there. Thank you for all of your questions to our listeners today. We have a question from Saraí, and she asks if any of your organizations need volunteers. That's a good one. Someone who's been inspired by you all today. Who wants to take this one?
So many of the organizations depend on volunteers. And I would say that Cristina is an example of an organization, as well as other federally qualified health centers that are working with organizations such as Erie House and Brighton Park Neighborhood Council, and you've got the pillars organizations, you've got the Alivios of the world, working with trusted messengers, such as the organizations that individuals that Cristina works with.
Mm-hmm.
Yes, absolutely. Yes, I mean, I think you can, depending on what that interest would be, what kind of volunteer work you're interested in. I mean, you can definitely look at all of our some of the websites. You can definitely see on there who you can contact. There's a lot of work to be done, not just with outreach around vaccine, but folks distributing food around food pantries, making sure that other prevention type of work is still happening. And so it really is, I would encourage all, whoever is watching to just please start looking at our websites to see, what are those things that interest you, and reach out. There's a lot of contact information out there as well.
Yeah, definitely. And we'll leave some of that information for everybody. As we wrap up, because of course this conversation can go on for a long, long time, but we know it's late and we know that people have other things to do. But I would like to kind of end on a positive note. We of course have seen a lot of sadness in our airwaves and on TV. And because today is more about Latinas and Women's History Month, I would like to ask you all, what do you feel that you bring to the table because of your identity, because of your culture, because of your history, and what kind of assets do you think that you would like to highlight today in this conversation? Maria, we can start with you.
Great, thanks. Wow, where do I start? I think first of all, I'd like to honor and thank the elders, the ancestors that came before me, the women who paved the way for where I am today. And so as a result of the culture that they've presented me with, I feel that it's a strong work ethic, the family at the center of our work, and always we always have an extra plate at the table, and so giving back is important. And perhaps why I went into the nonprofit work and as a social worker. Thanks.
Thank you. Adela, how about you?
I'm so proud of being Latina. I'm so proud of being South American. I'm so proud of being Colombian. That will always be a part of me that I have tried to bring to everything. There's no, if I'm in a board meeting and someone brings in the food and I see that they're Latino, I thank them in Spanish. And they are so appreciative, and that to be recognized. This is who we are. We have another language. We have, a whole culture around family and beautiful traditions. And I've tried to imbue those in my 3 daughters. And I honor and cherish that. And that's not something that I'm ever going to be ashamed of. On the contrary, I'm very proud of that. And I know that we have all the capacity to be everything that we want to be. We just need to be paid for it.
And Cristina, how about you?
Yeah, yes, to all that has been said. And I also feel muy orgullosa and proud to share a panel with 2 trailblazers, with other Latina women that have worked really, really hard, are continuing to serve our community. And I think that that's what I want to be. I want to be like you, right? I do want to ensure that there are still Latinas that are working really hard to also like mentor folks that they're working with or that they're supervising, or that and making sure that they feel very proud of who they are. I've had in my short career in management and leadership, folks say, I haven't had a Latina supervisor. You're my first one. And so those are big shoes to fill. That's a lot of pressure, but I think that if we can continue to develop leaders, specifically women of color, and really make sure that they are surrounded by women that empower them, that remind them that they're beautiful, that they're great, I think that we have a bright future ahead of us.
Yes. And it was a pleasure speaking with all of you today. I hope that, fingers crossed, we get through the pandemic safely. And I would love to have un cafecito with all of you in person one day. It was a pleasure. And I want to thank everybody listening today for participating in today's Chicago Tonight Latino Voices, a WTTW News Community Conversation. A reminder that I'll be hosting Chicago Tonight Latino Voices this Saturday, so be sure to tune in. It'll be at 6 p.m. on Channel 11. And tune in to hear me on 91.5 WBEZ for NPR's Weekend Edition on Saturday mornings, and on Sunday mornings. I want to say one more time, gracias a todos. And now I will turn it back over to WTTW's Tim Russell.
Thank you, Araceli, for hosting today's conversation. And I would also like to thank our panelists, Adela Cepeda, Cristina De La Rosa, and my good friend, Maria Pesqueira. Thank you all for joining us today. We've shared a short form in the chat. If you click it, you can submit ideas, stories, topics, and issues to us that we need to be covering. Please take a moment to fill out and share your thoughts. Please join Chicago Tonight Black Voices host Brandis Friedman on Monday, April 26th at 8 p.m. for our Chicago Tonight Black Voices Community Conversation. Finally, thank you to our members and viewers for your support. Your support allows us to engage with Chicago's diverse communities through our early childhood programs, our WTTW News Community Conversations, our documentary screenings and conversation, and access to the arts through our introductions in the community and classical conversation. We appreciate your support and thank you for allowing us to be your window to the world. Thank you again for joining this evening, and take care.